Hi guys, this is going to be part 2 of our chapter 5. We're going to start with HIV, which is our B20. I'm going to share our screen and we're going to go through some slides together. Okay, human immunodeficiency, B20. B20 reports HIV infection and includes AIDS. When you go into your ICD-10 and you look at the guidelines that B20 holds, you're going to see a lot of these very important points there too. Okay, positive serology or culture but no symptoms, you're going to report Z21 because that's asymptomatic HIV status, which means they don't have any symptoms. HIV exposure, but no positive serology, you're going to report Z20.06. It's contact / exposure to HIV. Inconclusive serology is R75, used for newborns of AIDS mothers. That's what that R75 is used for, newborns of AIDS mothers. Okay, you only can code confirmed cases of HIV infection and illness. Should be coded because the diagnosis stays in the patient's record forever. You cannot take it off, or it's almost impossible to take off an HIV diagnosis once you put it on that patient's record. So we always have to stay diligent and make sure that if we are actually coding a diagnosis code of HIV, that we know for a fact that the patient has that. If a patient is admitted for an HIV-related condition, the principal diagnosis should be B20, followed by additional diagnosis codes for all reported HIV-related conditions. So, if I'm an HIV-positive patient and I go into the hospital because I've broken my right leg, I have a fracture of my femur, my diagnosis code is going to be, the primary is going to be fractured femur, but you always have to include B20 because that's part of their history. That's something the insurance company needs to know every time. Z21, asymptomatic HIV infection, is not to be applied when the patient without any documentation of symptoms is listed as HIV positive, known as HIV test positive, or similar terminology. So known HIV or HIV test positive or similar terminology. So we're going to continue HIV testing. You're going to report Z114, encounter for screening for HIV. So you guys, I hope that you have been bubbling and highlighting those Z codes because here you go. You're going to need to know where these things are. You're going to assign additional codes for documented high-risk behavior, Z72.51, high-risk heterosexual behavior, Z72.52, high-risk homosexual behavior, Z72.53, high-risk bisexual behavior. If the visit is for a patient's HIV status, code B20 first, followed by any additional diagnosis that may exist. If the patient goes to the physician due to a sore throat and happens to be HIV positive, code the sore throat first and then HIV second. So we're going to watch a video. Oh, sorry guys. Let me get back there. Here we go. So I hope you were doing a little bebop dance when that was going on. An HIV patient presented to a clinic, this is an example, with what he thought was bruising. A biopsy was performed and a diagnosis of Colopses sarcoma of the skin is confirmed. B20 well, let's just say HIV disease. Then you have your Colopses sarcoma of the skin is C46-0. C46 Colopses sarcoma, which reinforces the guideline by stating to co-first any human deficiency virus, HIV disease B20. If a patient is admitted for an unrelated condition, the code for the unrelated condition should be the first listed diagnosis. A patient presents for a checkup for his acute diastolic congestive heart failure. She also has HIV. What are we going to code first? In this case, the patient is being seen for her CHF, which is not related to her HIV, so the CHF is coded first, followed by the B20 for HIV. If a patient is being seen to determine his or her HIV status, Z11.4 encounter for screening for human immunodeficiency virus. Use additional codes for any associated high-risk behavior. And if you'll remember, we listed those on a slide previously. If a patient with signs or symptoms is being seen for HIV testing, code the signs and the symptoms. An additional counseling code, Z71.7, HIV counseling if applicable. What happens if a patient has been tested for HIV and is coming in for test results, and they are negative? When a patient returns to be informed of his or her test results and the test result is negative, it's Z71.7. It's the counseling, it's the HIV counseling. Okay, so let's look at this example. Patient client returns today to be screened once again for HIV. The laboratory evidence for the HIV test conducted 2 weeks ago was inconclusive. HIV counseling was provided during the previous visit. The client has questions that required additional counseling during today's visit. You're going to do Z114 for the screening. R75 human immunodeficiency laboratory evidence, and Z71.7, which is counseling. Let's do some coding tips. HIV coding tips: codes designated as principal diagnosis codes are always sequenced first. Codes designated as secondary or subsequent diagnosis codes are never sequenced first. Opportunistic infection codes are always assigned as the secondary diagnosis if supported by the medical record documentation. So this says stop here, but I'm actually going to move on into neoplasms now, just because this is such a long chapter and we only have this week to get through it. So we're going to go ahead and do neoplasms. That's chapter 2 in our ICD-10. So C00 through D49. C00 through C96 is malignant neoplasms, primary and secondary. D00 through D09, cancer in situ, not invasive. D10 to D3A is benign. D37, I think that should be D36. It says D30A, D3A, it's D36. D37 through D48 is uncertain, not clearly benign or malignant. D49, unspecified behavior, not stated as to behavior. Neoplastic conditions can affect all parts of the body. First, locate the type of neoplasm in the index. To properly code a neoplasm, it is necessary to determine from the medical documentation whether the neoplasm is benign, in situ, malignant, or of uncertain histologic behavior. Remember, we have a neoplasm table to be able to look these things up on. If malignant, any secondary site should also be determined. Okay, so let's talk about stages of neoplasm. Staging for renal cancer stages. Stage 1, tumor of kidney, capsule only. Stage 2, tumor invading renal capsule, vein but not fascia. Stage 3, tumor extending to regional lymph node vena cava. Stage 4, other organ metastasis. Pathology report and staging information will be documented in your medical record. Stage neoplasms means that they are evaluated for placement on a grading scale based on the level of invasion. So your stages are based on level of invasion. Sequencing and complications. Treatment directed at the primary site, sequence first the primary. Secondary site, sequence second. Types, chemotherapy, or this is the types of treatments, is Z51.11. Again, guys, a Z code. Immunotherapy, Z51.12, and radiation therapy, Z51.0. Complications, sequence the complication first. History of neoplasm code. So what is a history of code? That means they had a history of neoplasms. History of neoplasm codes are only reported when neoplasm eradicated and is no longer present with no active treatment. For example, Z85, personal history of malignant neoplasm. If active treatment, such as chemo, no history code can be reported, because if you're still being treated, you don't have a history of it, you still have it. So you can use Z85 if the patient has a history of neoplasm and it applies to what you're doing and your doctor said he wants that coded as a diagnosis, but if they're still having active treatment, it's not a history of, they still have it. Do not report a history of Z codes if the patient must no longer be under any treatment for his or her cancer. This includes chemotherapy and or radiation therapy. If a neoplasm is being treated following surgical removal of the cancer, report the neoplasm as it still exists. because they're still going to have chemo or radiation. Okay, so let's see, how long is this one? Okay, we're not going to watch this one. Let me go back. I will make sure that I put up this boot camp Neoplasms for you guys. Whenever I upload this, I'll upload that too. Okay, so we're actually going to stop there. So since we're stopping there, let's go ahead and put this on to play because it's so important. These boot camps are amazing.
Chapter 2 of ICD-10-CM is for neoplasms. This presentation will cover the official ICD-10 guidelines specific to this chapter. There will also be clinical scenarios to practice coding what you just learned, followed by a small quiz at the end of the presentation. For each coding example and quiz, you will need to pause the webinar and use your ICD-10-CM coding manual to code the scenario. Once you resume the webinar, we will go over the correct codes, the rationale behind them, as well as how to locate them in the ICD-10 manual. Keep in mind that there may be more than one way to find a code. We are aware that there is a great deal of information contained in this presentation. Therefore, at any time during the webinar, please feel free to pause and replay as needed. It is important that you have...
Okay guys, I've changed my mind because there's so much information in it. I'm going to run out of time on Zoom. I will put up the bootcamp link for Neoplasms, so that way you guys can watch that. Whenever I'm giving you these bootcamp ICD-10 videos, please, please, please watch them. If you can only do it for 10 minutes at a time, the information that I'm giving you in these videos is not fluff. It's great information and it's key to being a successful coder. So I'm going to go ahead and stop share. You guys have a great afternoon. Let me know if you need anything, and I'll talk to you soon. Bye-bye.